So everyone, we're now going to dress this wound for this patient. So obviously you might have collected all the equipment you need to already, or if the wound was new to you, you might have decided what equipment you need to later. So if we're going to be dressing a wound, we need to prepare our trolley, so we perform some hand hygiene, and then we need to clean the trolley thoroughly with whatever is the chosen wipe for your trust. If you're cleaning a trolley for a sterile procedure, you obviously need to clean it from the top down, clean all sides, all legs, the whole trolley, and then we also need to clean the lower shelf as well. Once that's done, we then need to perform hand hygiene again, and we need to collect the equipment that we need. So for this patient, I'm going to collect a dressing pack, which is the same that we used for our catheterisation in CS3, because it has all the stuff that I need to for wound cleaning. I'm going to get an extra pair of sterile gloves because I've got slightly larger hands in those dressing packs. I'm going to get some extra gauze, just in case I need some more when cleaning this wound. I'm going to get some cleaning fluid. I'm also going to get an alcohol wipe to clean this packet with before I open it. I need the dressing itself that I'm going to put onto the person. And just because I can see on this wound that there is a little bit of liquid there, I'm going to swab it to see if there's any kind of bacteria that I can get from this wound. So I've got all of that, and then I'm going to either approach my patient now, or I would have had all this stuff already, and I need to set up my trolley. So, first of all, I'll need to lay out my sterile field. And then I need to very carefully open up this sterile field as we did when we did catheterisation, without touching any of the areas of the sterile field that need to remain sterile, so keeping our fingers just very much in the corners of the sterile field. If you open it up, so you just touch the straight edges, you'll find that the dressing pack should open up relatively smoothly as we're going through. This one's a little bit folded over, but I'll just touch the very corner that I can get to here and stretch it out there. And then last, I'll stretch it out here. Now, I'm not going to use those gloves that are in there because they're a bit too small for my hands, but I am going to put, as you can see, my galley pot, well, you can't see it, but my galley pot is actually exposed, so I can put my cleaning fluid in. So I'm going to clean this sachet with this alcohol wipe before I open it and then allow it to dry. I might obviously all this stuff I could have done before I approached the patient, so, but if you're by the patient, you also have to try and be as patient as they can as you prepare all this. I imagine sometimes it might be reassuring for patients if you do a good job of this to actually see them doing a good job preparing and being nice and careful. I've never really had a wound myself. Maybe I should ask someone. Carefully take my gauze out. I've got my swab here, so I can take that out of its packet if I want to, because it's sterile. If I was going to do that, I'd hold the swab very carefully and buy the packet and then drop it onto there rather than tipping it out so it doesn't fall everywhere. I've got my dressing itself. Some dressings you might leave in their packets, but this one I can take out of the packet and I can place it onto my sterile field very carefully. And then I've also got my sterile gloves, which I want to open up onto on a clean surface. You don't have to open up onto your sterile field, obviously, because you're going to be touching this outer packet. So I will open up on a nice clean surface, maybe over here, and we'll fast forward through this bit so you don't have to wait for me to do this. Okay, so I'm all ready to go. Obviously, be careful not to get my apron onto anything. I can then arrange my sterile field so I can access all of the things I need to. I can get rid of these gloves, I've got all my extra sterile field that I have in here. Now I would probably want to use this to cover maybe the dirtiest area that I can. So I'm going to put this at the base of my wound to cover that area. So I've got a sterile field next to it. I've got my bin that I can open up. I would put that over here. I would actually place this on the bed next to the patient so I can put all my dressings in. I don't have to go back over my sterile field to access my bin. I'm going to then have a think about how I'm going to clean this wound. So I would want to clean this wound using gauze. You might clean the wound with irrigation, maybe using a syringe to squirt the saline in, careful not to splash stuff in the eye. But for this patient, considering the pain control and things, I'm going to actually use gauze to actually clean the wound. If I'm going to use gauze, I'm going to use a clean hand, dirty hand method. So I'm going to have one hand that's going to be the one dedicated for cleaning and wiping, for wetting the gauze and putting in the saline, and the other hand is going to be used for actually the wiping of the wound. So I'm going to separate out my gauze so I can actually access each bit. And then I'm going to place one hand in here. I'm going to wet that gauze, and I'm going to pass this gauze to my other hand, and this hand, without touching the two, I'm then going to clean. On a wound, you try and go from the cleanest area to the dirtiest area, so you don't wipe new bacteria. So if there's a particularly infected area of the wound, you don't want to wipe from that area to the rest of the wound. So I'm going to clean from the top down and try and wipe away some of this exudate. So as I go through, I'm then going to use my clean hand again to wet my gauze, and then pass it to my dirty hand and wipe down. And you just wipe it as many times as what is necessary for the wound, which might be tons, it might be just a little. If there's anything really complicated about the wound, like you feel like you might need to take away some non-viable tissue or things like that, then you might actually need to consult someone to help with that. You might feel, if you're experienced, you might feel you want to tackle that yourself. But I'll leave that to you in judging the wound when you see it. So once that's all wiped down and you're happy with that wound, we can then actually, if we want to at this stage, we might want to swab the wound, because we've got rid of all of the surface bacteria and things that were there which aren't necessarily causing an infection, and maybe some of the dressing content, if it's got some kind of coating on the dressing, and we now want to actually swab the wound. So you've got our swabs here. These are charcoal swabs, universal swabs, and these look for all different bacteria. So any bacteria that's there. In the bottom there you can see that black substance is actually charcoal, and it's actually sealed at the moment, so you can break the top off this with your clean hand, and then you can then swab the wound itself. So if you use your dirty hand to hold that, and then you can swab the wound, twiddling the swab in all different directions, making sure you get all the areas of the wound. You might want to go in a zigzag pattern across the wound, and then place the swab inside the container, and that's now sealed. Now that's done, our wound is ready. We now want to place our dressing onto our wound, and all dressings have their different ways with which they attach. Some have different layers you've got to take off. This is quite a simple self-adhesive dressing. So this dressing has sticky edges around it, and it's non-adhesive in the middle. What we want to do is peel off the outer edges of this dressing without touching the area in the middle that needs to remain sterile. And I'll peel off that edge first, so I can get rid of that layer. I can place that there, and I might then want to place that over my wound, so the sticky edges are on the viable tissue on the outside, but the core of the dressing goes over the wound itself. And then I can peel off the outer edge, making sure I don't get my sterile field caught in there, and I can make sure that sticks down past the wound, making sure the top sticks down. If the bottom does fold over, make sure you just pull that out and then stick that down, smoothing out the edges so the wound is nicely sealed, and then that is all done. We now need to make sure that we cover the patient, thank them, make sure they're okay, take our gloves off, obviously please don't touch the patient's gown, wash our hands, Like we said, thank them, ask them, make sure they're in a comfortable position or if they've got anything they need, and then we need to document everything that we did and what dressing we put on and what we found. If we have done a swab, we obviously need to make sure that we've ordered the swab and that we've stuck a sticker on the swab before we've left the patient so we know it belongs to that patient and send it off to the lab. Okay, well, thank you very much, and that's the end of these videos.